Can people see that slide and hear me okay? If I could get a nod from someone. Beautiful, thank you. I will also acknowledge that I am coming to you today from the lands of the Bunurong people of the Kulin Nation and pay my respects to their elders past, present, and any people here who identify as Aboriginal or Torres Strait Islander. And I will start by saying I admit I think it was an oversight of mine that I haven't updated some of these slides to refer to just Cancer Council. So I do refer to Cancer Council Victoria throughout this presentation, though most of the programs and services we offer are operated at a national level, and your respective state-based Cancer Council office will run the same, if not a very similar program. So I will clarify that where I can, and if there's any confusion, please feel free to raise your hand, but I do apologise for that. As mentioned, I've been with Cancer Council for about 5 years, and in that time I started working in cancer screening and prevention and transitioned into support, working on a few of our support services that I'll cover in this session, and I'll also speak largely about our Cancer Connect peer support program, as that is where I have been for the past few years. But overall, the session today will cover the various support services that are offered by Cancer Council, and harrowing in on the role of our 13 11 20 information and support phone line, which is staffed by our wonderful cancer nurses as well. I have allowed time for questions at the end, but as I said, if there's anything that you'd like clarified in the moment, I'm happy to take them during the presentation as well. The way I describe Cancer Council is that we are largely made up of 4 main areas, in being cancer research, prevention and support, and supporting all of those 3 areas is our fundraising and communications division as well. So our goals are to prevent cancer, change the environment to enable healthier behaviours via powerful prevention policies and programs, detect, increasing participation equitably in cancer screening, early detection and immunisation programs, care, enable all people to have equitable access to trusted cancer information, support and optimal care, which is what this presentation is largely about, and research, discover new prevention, detection and support opportunities to improve cancer outcomes and save lives. Most people access our support programs by calling our 13 11 20 phone line, which is staffed by cancer oncology nurses, Monday to Friday between 9 and 5 for the cost of a local call. People can also access 13 11 20 out of hours by calling the number and leaving a voice message that is returned within 24 hours or 48 hours if over the weekend, or by emailing Ask a Nurse as well. The nurses provide evidence-based research and trusted information on cancer and emotional and practical support as well for people who have cancer, are caring for someone with cancer, family, friends, and also health professionals who may have inquiries as well. They're also across our prevention strategies, so the bowel screening program and cervical screening, and take many inquiries from the public about those programs as well. They can't provide individual medical advice for obvious reasons, but they can help people and empower people to formulate questions to ask of their treating team, or clarify information that has been communicated to somebody from their treating team in a accessible format, and to allow for perhaps longer time than is available in many of the appointments as well. They're trained to listen and to refer to various support programs, both our own programs in Cancer Council and also programs and services that are available in your local community. All calls and email are confidential. There's also the ability to speak with a cancer nurse in languages other than English, and they can talk confidentially to a Cancer Council nurse through the help of an interpreter by calling the number 13 14 50. Many people from culturally and linguistically diverse backgrounds can experience a range of specific issues after a cancer diagnosis, including feelings of isolation and perhaps a lack of understanding in some instances too, with clinical terminology and medical instructions. With the help of an interpreter, the 13, 11, 20 nurses can explain medical terms and procedures and treatments, provide written resources in the caller's language, and put people in touch with others who have been through a similar experience using an interpreter or a volunteer who speaks more than one language. The number to access a cancer nurse in a language other than English is 13 14 50 in between the hours of 9 and 5, Monday to Friday. We have a wig service. I believe this service is only operating out of Victoria, and the ACT as well also have one. And in 2020, we moved the service to being an exclusively postal service for obvious reasons. We did previously do face-to-face consultations with a cancer nurse in our office, and we haven't. When we transitioned to a postal service, we have remained exclusively postal for now, and we're doing video consultations, as with many other services that had to adapt during the pandemic. We can provide wigs free of charge to people who could not otherwise access a wig, and the person is able to keep the wig for as long as they wish. If they wish to keep it forever, that's absolutely fine, but we do encourage people that if when they no longer need a wig, they could return it to the service so that we can provide it to somebody else who would benefit from a free wig. We also provide free cotton caps and headscarves and tutorials on how to style different headwear as well. And we're able to do this through the generous donations from the public and also the support of wig suppliers in Victoria who partner with us to provide this service free of charge to the community. And during the pandemic, we were the only wig service that continued to operate in all of Victoria. So we were exceptionally busy. And as I've said there, in the year 2020, it was 125 people. I believe the next year it was well over 250 wigs that were supplied. We find that the most common feedback we get about the wig service is that it gives them the opportunity to engage in society and community and feel perhaps when they don't wish to have a conversation about their diagnosis or add some normality back to their situation, and perhaps at the workplace or it's attending an event. It's a particularly lovely service that we're able to provide for people. People who call 13 11 20 are also able to access our financial counselling program, which provides people affected by cancer access to a qualified financial counsellor who can provide practical advice and guidance to help manage the cost of cancer. And in some instances, they can advocate on behalf of the people calling as well. They can advocate to creditors where required and empower people through information so they can make informed decisions about health and long-term financial security. There are some eligibility criteria that do differ based on the state that you're in, and this service can be accessed by calling the 13 11 20 number. That number can be called anywhere in Australia, and it will direct you to your local Cancer Council office. So that's the same number for the whole of Australia. I know the financial counsellors are particularly busy. Here in Victoria, we have 3 full-time financial counsellors and we're recruiting further. It's a fantastic service to be able to provide for people. And I think, as we're all aware now, perhaps more than ever, it's a particularly difficult time, let alone to have an illness on top of that as well. So it's a great resource for people to help navigate some of the added stresses of financial pressure. We also have qualified nurse counselling. So this is a new service that, again, was prompted from the pandemic and the increased need for emotional and psychological support in recent years. It started as a pilot program and was so successful and so in demand that we, in Victoria at least, employ 2 full-time nurse counsellors, and I know that the program is run out of other states as well. So these are nurses who are oncology nurses, but in addition to their nurse oncology qualifications and experience, have completed counselling degrees as well. So they're able to really, they're very specialised. And there is a limited number of sessions, although people are welcome to have more than one session and to speak with the counsellor for about an hour. And it is entirely a phone-based service as well. And that was another reason why we identified the need in the pandemic, when so many people were isolated, particularly affected by cancer, and not necessarily in a position to be able to access face-to-face support. We run cancer education programs in the communities. So they are group programs that are delivered by health professionals working with cancer patients, carers and survivors. And these programs are run in the community. So they might be at a hospital or a local council. They're trained, the health professionals are trained by the Cancer Council officers to become program facilitators, and they're also supported by the health service they're employed in to run the program as well. To give you an idea of how many people are involved in this program, in Victoria alone, there are over 250 trained facilitators across 70 different health services. And the most recent figure I could pull was in 2019, 935 patients and carers attended education sessions just in Victoria alone. So it's a really important program that we have on the ground. The 2 main programs we offer are managing cancer. So that's for those who are recently diagnosed and receiving treatment, with the aim of developing resilience and communications, and enables participants to connect with other people. And following on from managing cancer, we have cancer wellness, which has also evolved into cancer wellness and exercise. And for those who have completed primary treatment or are receiving ongoing treatment. And it's a program to help people adjust and develop strategies to improve health and well-being as people move from treatment through to recovery. There's also an option for health services to run 8-week programs that involve an hour of exercise and an hour of education per week too. A lot of the work done by our Cancer Information Support Services team, which is the team I fall within, is developing our resources to provide to members of the community to communicate cancer information. And these are designed, again, for health professionals, patients, families, friends, carers, absolutely anyone. There is a wide range of fact sheets, booklets, brochures, CDs, podcasts, as we've transitioned to a more digital world, and over 100 variations, and in all sorts of different languages and accessible formats such as large print as well, all available free of charge and can be ordered via the website or calling the 13 11 20 phone line as well. And they're fantastic. I'm not sure, you might have seen them in various treatment centres or through your nursing team, but they're really widely used in the community and updated very regularly. So they're very up to date, trusted, peer reviewed and evidence-based information. And I'm obviously people are aware of what a cancer support group involves and the importance of them through attending one like this group. But what we do at Cancer Council is we don't actually run cancer support groups ourselves, but we recognise support groups. So we can help them by helping them become aware of our various services and resources, which I'm doing today, and also up-to-date information with what Cancer Council is working on in terms of research and updates, and provide emotional and practical support as well through liaising with the Cancer Support Group's coordinator. They're, as you know, a great way to learn about living with cancer and particular diagnoses, especially in a group that is made up of people going through a similar experience to one of your own in terms of diagnosis. And they're slowly returning back to pre-pandemic levels. So last year in Victoria, we had 77 cancer support groups that were recognised in Victoria. And we have a few different ways that they can take place. There are face-to-face, there are Zoom groups, and there's also telephone-based support groups as well. So just old school telephone calls, not necessarily video as well. Cancer Connect is the program I work on, so I'm going to spend a bit of time talking about it. It's a flagship program that was developed by Cancer Council over 30 years ago, where we are able to link somebody affected by cancer with a trained volunteer who's been through a similar lived experience. Conversations are one-to-one and they always take place over the phone. So the people never meet face-to-face. And that is a huge part of the program that people find most valuable, as wonderful as cancer support groups are, and connecting with people either face-to-face over a telephone call or in person. People also identify that speaking with someone who they don't know and they don't have that connection with has its place too, and provides the opportunity to perhaps be a bit more vulnerable or share information that they may not otherwise share with somebody they know a bit better. People are able to have up to 6 calls with their volunteer. So we do encourage people to have multiple calls, but we don't encourage them to speak forever. It is not an ongoing friendship or buddy program. And I become aware of the number of calls people have. At the end of each call, the volunteer submits a form to myself, just letting me know that the call took place. I don't know what the people speak about. The calls are entirely confidential between the volunteer and the person they're supporting, unless, as was mentioned at the start of this meeting, if any issues arise in the call that the volunteer is concerned about and thinks that we need to know in terms of safety. There are a few different elements of Cancer Connect. So by and large, the most popular or most accessed is Cancer Connect, that's linking people who have a cancer diagnosis themselves with a volunteer who has been diagnosed with the same cancer that they have been. We do ask that volunteers are 2 years post completion of treatment. That's not black and white. We understand there are many different reasons why somebody may not ever go off treatment, but we do ask that some time has passed so that the person can speak about living post-diagnosis and survivorship, and has also had time to process what they've been through as well and ensure they're in a good headspace. I will, after this, speak about becoming a volunteer and go into those details further in case anybody is interested. People tend to fall into one of 2 camps in terms of wanting to speak with someone who's been through a similar experience. So they'll generally have really specific questions about treatment or a procedure perhaps, and want to speak with somebody who's had that exact same treatment or procedure. And then in other instances, people say, actually, I don't really mind what cancer the person had, but I really like to speak with someone who had young children when they were diagnosed. So it can either be sort of more of that clinical and treatment-based knowledge sharing and support, or more of the emotional and social support. Of course, the volunteers cannot provide advice or even their opinion, but they can share their experience and perhaps some of the things that helped them and how they came to their decision-making process for them. We have a few other arms. The next one that is the next popular after Cancer Connect is Family or Carer Connect. So we can link people who are looking after or caring for a loved one with cancer with a volunteer who has been through a similar caring experience. We have volunteers who have been spouses, mums, dads, sisters, brothers, mothers, daughters, fathers, sons, all for a wide range of various cancers as well. And we find that with Cancer Connect, we do try and update the pool of volunteers quite regularly as treatment does change so rapidly these days. But whereas in the caring space, those emotions and that experience is likely to be very similar, whether it was 2 years ago or 10. So we do find that we have people who have a wide range of histories as well, as compared with Cancer Connect. I also find it interesting, the carer calls tend to be a bit longer and have more of that ongoing nature. So they tend to meet their 6 calls more than the Cancer Connect calls, which I find interesting. So we sort of, although we get fewer of them in terms of referrals, it is still a really valuable service that we can offer people. And then a smaller portion of volunteers are people who have a genetic predisposition to certain cancers that we can link people to speak if they have the same genetic predisposition and would like to speak with somebody who has that. We have most of those volunteers have had a cancer diagnosis as well, but we do have some volunteers who are, say, for example, BRCA1 or 2 positive and have had preventative surgery without a cancer diagnosis. And that's a really valuable service to be able to offer people who are asking similar questions and making similar decisions. And last but not least, we have Trial Connect, whereby some of these peer support volunteers who have experience of being on a clinical trial can speak to their experience of what it was like to be on a trial, how they got involved in a trial, what was their decision-making process, how does it work, and help demystify some of the myths and misconceptions about what being on a clinical trial is about too. It's a very popular service in Victoria alone. Last year we had 347 people who were referred into Cancer Connect, and I use that term to cover both the carers and Jean as well, to speak with a volunteer who had a similar lived experience, and that resulted in over 500 phone calls. So it is a very busy service, and most people find out about it by calling the 13 20 number and the nurse on the phone line, identifying that that person could benefit from speaking with somebody who's been through something similar. Though people can also self-refer on the Cancer Council website as well and submit a request to be linked with a volunteer. Was I going to say something else? I can't remember. I think just second to the most common valuable feedback we get about the program is one, that anonymity and de-identified nature of it, but also people saying that as wonderful as their treating team and their family friends are, hopefully, and in most instances, those people around them haven't been through, and they can't understand what it is like to have the same diagnosis. And that's sort of the missing piece and the gap in the support and treatment that this service is able to fill. I will share a video now. This is Navina, one of our volunteers. I guess she's one of many people who accessed Cancer Connect when she was diagnosed and found it so valuable that she went on to become a volunteer herself, which is really lovely to hear that people find it so beneficial. And yeah, she's one of several who have come to volunteer having used it themselves, which is always wonderful. I'll just swap my screen, bear with me to play the video.
felt well supported by my parents and my friends and the medical community, but I felt there was something missing. And initially I couldn't put my finger on it, but I happened to be sitting in the hospital and I spotted a brochure for the Cancer Connect program. And I rang the 131120 number, and then I realized that I was missing the experiential knowledge. I got more than just emotional support from the Cancer Connect program. I got someone who can actually listen to me and who could give me time. You could access the Cancer Connect program almost when you wanted it and spend as much time as possible with it, and ask them questions that are deeply personal at times. That is easier asking a stranger over the phone than asking someone face to face.
So that's Navina. She is one of our superstar volunteers. She speaks with a lot of people, but I think that's a really nice summary, and it's lovely to hear the same messages I repeated to you earlier, but to hear it from somebody who's actually accessed the service. And so Cancer Connect is available nationwide, and Mira mentioned that someone's dialing in from New Zealand, and it is available in New Zealand too. We have a relationship with a cancer society in New Zealand, and we, through Cancer Society New Zealand and the various offices at in Australia for Cancer Council, we are able to provide this service nationwide. So here in Victoria, I cover Western Australia and Tasmania, and the various territories, Northern Territory and ACT, are covered by SA, New South Wales and Queensland. So, for example, if somebody is referred in, if they call from Victoria into our 131120 service and would like to speak with someone, but I don't have a volunteer in my pool of volunteers who has got a similar experience, I can refer to those other states and link that person in. So it's lovely to be able to connect people all over the country and make sure that that service is available as far as New Zealand as well. So to become a Cancer Connect or a Carer Connect volunteer, you can express interest on the state-based website for where you're located. I provided my number there, and I'm more than happy to take phone calls from anyone in this group. And if I need to direct you to your state-based office, I can certainly do that. However, if you're based in Tasmania, Victoria, or Western Australia, I would be your point of contact anyway. And similarly, I'm happy to take emails from anyone as well with questions about accessing the service or becoming a volunteer yourself. And I suppose it's important, I'll let you know sort of what's involved in becoming a volunteer, not only if it was something that you might be interested in now or one day, but also if you're interested in accessing the service and you'd like to know, what does a trained volunteer mean? So everyone who is a volunteer submits an application form, which is quite lengthy and outlines their experience of whether they were a carer or had cancer themselves, and what that was like in terms of treatment. So what treatment did you have or the person you were caring for have? What is your lived experience of cancer? How are you affected by it? And after submitting that form, we do a lengthy telephone interview with every volunteer, myself over Microsoft Teams or the coordinator in their state. It's really an opportunity for that person to elaborate on the details they provide in the form, and to make sure that they have all the information they need to make sure that it's the kind of role they'd like to do. And of course, for us at Cancer Council to deem that they're suitable and in a good headspace and ready to provide the role as well. After the telephone interview, there is a 2-day induction training, which is now run on Teams. And it's really 2 half days, sort of 9 a.m. till 1 p.m. We run them roughly every 6 months or so, waiting until we have a good group of people ready to go to run one. And the training covers how the program works. So what happens when, how do you come to be selected for a phone call with someone? What's the process? And what do you do when you are selected? And how that works is the 131120 nurse will identify that somebody would benefit from speaking with a trained volunteer. I get the referral, and on that referral, I have information about the person's cancer experience, what it is they're going through, what are the sort of issues that they would like to connect with a volunteer, and then demographic information like their age and location and family situation. And I use that to match them with the volunteer who's had the most similar experience. I ask that volunteer if they're available to take on a call and whether they'd like to as well. So obviously the volunteer has the right to say, you know what, I wouldn't feel comfortable, or I'm not in a great place right now where I want to speak about it, or I'm busy on a holiday. But if they are available to take on a call, I pass on the first name only of the person they're going to be supporting, the phone number of the person they will support, age, and a bit about the person as well. And then if there's a best time to call the person and that they've nominated, I'll pass that on as well. Otherwise, it's up to the volunteer to call at a time that suits them. They'll always call from a blocked number, and calls are one way always from the volunteer to the person they're supporting. So they don't exchange phone numbers. The best way to set up a series of calls is to arrange it at the end of your previous call. However, if the first call ends and no follow-up call is arranged, the person who is receiving the support can simply call 131120 and we can arrange for that volunteer to give them another call. And as I mentioned before, at the end of each phone call, the volunteer submits a contact form to let us know the call took place. They identify the time and date and how long the call went for, what number call was it. So that's how we can tell if somebody's having multiple calls, really frequent calls, really long calls, in case there's, and it's usually just a matter of us asking whether we think that person might need a more formal support, like counselling. And that is it, really. That's what's involved in being a volunteer. It really depends on who comes through our doors as to how busy that volunteer is and how many calls they make with people. But it's a really loved program, and the volunteers are highly engaged, and it's something I quite often, when I'm interviewing the volunteers or checking in on them, they say, oh, I feel so guilty. As much as I love helping people, I get a lot out of this too. So it's a beautiful program, and I feel really honoured to be able to run it. That leads me to the end of my presentation.